Assalamu alaikum and a very warm welcome, viewers. This is Mavish again. Last episode was such an amazing episode. I had such a great time talking with one of the best psychiatrists in Houston, Dr. Asim Shah. Without further ado, let me talk to him right away. First of all, welcome on the show.
Thank you.
How does it feel to be sitting as a guest? This is your show.
Right,
you
exactly.
know?
So it's changed.
Yeah.
Turn the tables, right? To me, it feels exactly the same because I've been on this side, I've been on that side. Both.
Yes.
I do a lot of this side stuff also, meaning as a guest, and I do a lot of hosting also. And even when I'm hosting, I somehow feel that I'm the guest too.
Right.
And a lot of times, you guys may not know, but my guests know, sometimes I feel that they may be stuck and I bring them back to the show. So it's kind of the same. I don't feel any different, but it's good to have somebody like you host the show. It's good also.
Well, thank you, and I'm really so thankful and grateful to you for the opportunity and to Geo TV and Ibn Sina Foundation for actually asking me to host your show and to interview you. Like, it is a huge honor for me. So I just wanted to thank you for that. डॉक्टर आसम व्यूअर्स डॉक्टर आसम के साथ जब हम लास्ट एपिसोड में बात कर रहे थे तो हमें इतना मज़ा आ रहा था. It was so spontaneous and we had such a good time, and there were so many questions and so many things that were just not asked because we didn't have enough time for the show. So we're going to try to cover as much as we can. He knows so much. He's like an encyclopedia. So it's I don't really, and I'm not flattering you. I am not flattering you. This is the truth. If you think this is not the truth, go to the last episode and see the first 5 minutes of the show, all the things that I told you about him. 100% true. So, okay, let's talk about, first of all, I want to talk about ADHD.
Sure.
So, in Pakistan, when I was working, a lot of people used to call it like a fancy disease. You know, there is not much to it, but there is a lot to it. And so what is ADHD? ADHD, what do you?
So first of all, it is a disease. There are 4 million people or so affected by ADHD in this country. Yes, it is more inflated in this country than other countries, comparing like Western countries. In UK, the incidence of ADHD is much less.
Really?
Diagnosis is much less than in this country. So yeah, true. When people say it is a fancy disease or it is a disease which is created and so forth, some of it is true in the sense that we diagnose it much more quicker and much more easily. The proper diagnosis of ADHD requires 3 settings: how you're doing in an office, how you're doing in a school, and how you do at home. हम ये सब information नहीं लेते. We just tend to diagnose very quickly. Second, the symptoms of ADHD need to start before the age 12. It used to be 7, now they changed it to 12. So we don't necessarily get that history. And if the symptoms are not starting at an early age, maybe they don't have ADHD, maybe they have something else. And with symptoms, the third thing, which is extremely important in psychiatry, is functional impairment. Meaning the person who has the symptoms, do they have any functional impairment? Which means for a child, failing grades. Not having B or C, because it can happen to anybody, but failing grades. So अगर ये तीनों चीजें मिलती हैं, failing grades, functional impairment, symptoms before 12, and really you have symptoms, and you have observed the symptoms in 2 of the 3 settings or 3 settings, yes, the person may have ADHD, but sometimes it's a little overblown because we make a diagnosis in 5 minutes. This is not a 5-minute diagnosis.
Okay. So when you say it's not a 5-minute diagnosis, then what is it? How long do you have to take your time to diagnose it? How does it work?
So if a child comes to us with ADHD or with the possible diagnosis of ADHD, we will give them questionnaire. They will take it to their home. They will take it to the school. Ask the teacher to fill it. Ask the parent to fill it. Bring it back. So you have some substantial data from the teacher, the teacher who is with you more than not, and the parent. Also, we want to observe the child in the office. Are they going around? Are they able to sit still or not? So you observe, school observes, parents observe. You combine everything, make a diagnosis, which takes some time. Sometimes if it's a grown up or an elder child, you even give them some testings in your office so that they can tell you certain things. And especially in adults, we do that a lot.
Okay, so there is something which is called late onset ADHD. Like if a 30 years old come to you and says, "Oh, I have ADHD, and then I want methamphetamine or amphetamine and all that kind of stuff." Like we'll talk about the treatment also because it's very important. So what do you do? Like, is there a late onset?
So we have a lot of people these days who come to us and say they're 30, they're 40, they're even 50. I even had a 67-year-old.
Right.
I have ADD, not ADHD.
Okay.
And I need stimulants. The truth of the matter is, even if you're 30 and you are being diagnosed now, the symptoms had to begin before the age 12. तो अगर आप ट्रैक कर सकते हैं कि symptoms थे 12 years से पहले, 12 साल से पहले, कोई functional impairment थी जो मैंने अभी आपको बताया, failing grades, maybe. If not, it's not easy. There is a reason in adults, a lot of time we do testing because they may or may not remember what happened 12 से पहले. So we would like to do some testing so that we can substantiate that. But before 12 history is extremely important.
Okay. So, what is the treatment? What is the main when somebody is diagnosed with ADHD? What do you give?
So the concept is that if you have ADHD, you'll give them Ritalin or Adderall, which is true, but there are other medicines also. We talked in our previous program about addiction. A lot of kids use marijuana or alcohol or vaping or something. In those scenarios, we may not want to give them Adderall because they can abuse Adderall also or Ritalin. In those cases, we may give them other non-stimulants. There are non-stimulant options also, guanfacine, Strattera, and clonidine. We can do that also. So it just depends on what the symptoms are and whether they're using drugs or not. But stimulants are the mainstay, but you have to be careful in using stimulants, especially if somebody is using substances.
Right. Do you think it is a good idea to give children stimulants, considering the number of side effects they come up with? The amphetamine. I was reading on this, studying on this drug, and horrible side effects.
If you have ADHD, meaning the child has ADHD, stimulants work very quickly. But to mitigate or minimize the side effects, what we do is a lot of time we say weekend holidays, meaning take it during school days, but not during weekends. Or summer vacation, spring vacation, we don't give them medication or winter vacation. So you can do certain things. आज से 10 साल पहले बहुत जिक्र था कि ADHD can cause growth retardation और height नहीं बढ़ती अगर दबाव दें stimulants. Lekin now we feel that with all these holidays and the proper dosages, so that is not necessarily the case. Sure, there have been cases of cardiac deaths associated with the stimulants, especially in Canada, about 20. So you have to be careful. अगर कोई history है family में तो हम EKG करवाते हैं. The doctor would take care of those things. Again, the take-home message is if the child is really suffering, it can certainly change the life of the child. But if they are not, and you are on the borderline, maybe you can do without it.
Okay, all right. That sounds very good. Thank you for talking about it.
Another thing people want to know about ADHD is, do people outgrow ADHD?
Right.
So, उसमें ये होता है कि at times what we use is we use a 1/3 formula. 1/3 of those patients outgrow. 1/3 of those patients kind of get used to their life with this problem, meaning they can work without medicine, but by modifying certain things. And the last 1/3 may continue the medication even as adults.
Oh, okay. So there's no such thing as a cure.
In medicine, the cure is taking the medication. What is the cure of diabetes? You take the
medicine. You have to take it. It's a lifelong thing.
You're a doctor, you know that same thing. So the cure is continue to take the medicine. So if you're thinking about...
You cannot stop it. You cannot say like, oh, I'm feeling good now.
It's not like antibiotic that you take it for 10 days and
it stops.
No.
Yeah.
It's management, not cure.
Okay, so you have to continue taking that and not just stop it because you're feeling good. So, okay, I'm going to stop that. It's not that way. Other thing that people talk about is, and that I wanted to talk about with you was the panic attack. And then sometimes people confuse it with heart attack because the symptoms can overlap. Right. And then viewers will talk about the symptoms of both and tell you what can be what. So what?
Sure. So panic attack is something which is very, very closely it resembles heart attack.
Right.
Why? Because you have shortness of breath, you have sweaty palm, you feel dooming, palpitations, sense of dooming, all of those things, and you feel like you're dying,
right.
Just like in heart attack.
Yes.
At times, at that particular moment, if you have a real panic attack, it may not be easy to distinguish. So you have to still go to the emergency room,
right.
Get your cardiac enzymes done, get an EKG done. अगर वो सब सही है, 4 घंटे बाद फिर repeat करें, then you can look into the other diagnosis, which panic is one of them. If you have already been diagnosed with panic, you will try to take a medicine to treat panic. And if it gets better, which they take 20-30 minutes to get better, then you don't have a heart attack. But heart attack mein hota hai ki usually you have shoulder pain also a lot of times, which doesn't happen in panic. Otherwise, the symptoms are very much similar and it can be confusing. So since heart attack is more severe, we always want to rule out heart attack.
Correct. So you always, whenever the patient comes to the hospital thinking that they have heart attack or, you just always differentiate that. That's good. There is another thing a lot of people talk about. Then again, I know you have done several episodes on depression, and there's something that I wanted to talk about in this episode is grief and pathological grief. What's
Good
this?
question.
Yeah, what is this fine line? How do you define that it is grief or it has become pathological?
In psychiatry, we have DSM, Diagnostic and Statistical Manual. हर 10, 12, 15 साल बाद ये change होती है, revise होती है based on the new research and new studies. Currently, we have DSM-5. मैं इसलिए ये बता रहा हूँ उसका background कि आपको अंदाजा हो कि grief की definition थोड़ी सी change हुई है. पहले हम ये कहते थे कि if a loved one dies, you can grieve maybe up to 6 months, and if it continues past that, it may be depression. अब थोड़ा सा हमने उसको change किया है, और वो ये change किया है कि if somebody has severe depression to the point of suicidality, even after a week of somebody's death in your family or so, that could be depression. You don't have to have a time frame. पहले हम ये कहते थे कि 6 महीने के अंदर जो कुछ है वो grief में आता है. अब ऐसा नहीं है. अब जो है वो depression. यानी severity symptoms अगर ज़्यादा है, it could be depression. और severity कम है, तो it could be grief up to 2 months.
All right. Thank you so much. Viewers, let's take a short break. We will be right back. Stay tuned.
We have expanded our clinics from one small clinic to 7 community clinics across the greater Houston and Port Arthur areas.
My name is Dr. Spencer Wood, and our goal is to provide high quality, affordable care for the community.
इब्न सिना में प्राइमरी केयर डॉक्टर्स के अलावा बहुत सारे स्पेशलिस्ट भी अवेलेबल है, जैसे कि कार्डियोलॉजी, डर्मेटोलॉजी, साइकेट्री, पोडाइट्री, न्यूरोलॉजी, नेफ्रोलॉजी और दीगर स्पेशलिस्ट मौजूद है जो आपकी सेहत की टेक केयर कर सकते हैं.
We are providing services like preventive care, including exams and dental cleanings.
Counseling and psychotherapy. If medicine taken properly can give a good life.
इब्न सीना की सर्विसेज जो मेडिकल सर्विसेज से शुरू हुई थी वो एक्सपेंड हुई मेडिकल, डेंटल, डायग्नोस्टिक, स्पेशलिटी केयर एंड मेंटल हेल्थ सर्विसेज. हमने स्पेशली मेंटल हेल्थ सर्विसेज सिंस लास्ट 1 ईयर से एक्सपेंड की है.
Welcome back, viewers. We are in conversation with none other than Dr. Asim Shah. Dr. Asim, we were talking about, before the break, we were talking about grief, pathological grief. And I'm so glad that you explained it so well. I wanted to talk about mania. What is mania?
First, if you think about mania, mania is basically opposite of depression. Depression में उदासी होती है, mania में खुशी इतनी होती है कि कुछ ज़्यादा ही खुशी होती है.
Okay.
To the point कि you are disturbing people, you are annoying people, you are irritable. But if you think about the symptoms of mania, the most important perhaps would be lack of sleep and lots of energy.
Okay.
Depression में होता है कि energy is gone. In mania में होता है कि you have too much energy to the point that you cannot control it. And you don't sleep for numerous days. Or if you sleep 1 hour. लेकिन आप फिर rested है. अगर मैं एक दिन ना सोऊं या आप एक दिन ना सोएं तो you'll be very tired.
No, I feel terrible if I don't say.
But many people don't. They're perfectly fine. They're doing things. So lots of energy with lack of sleep, talking too much, too fast, and at times irritable and annoying. So that becomes mania. फिर उसमें और चीज़ें ये आती हैं, थोड़ा सा grandiosity आती है, narcissism आता है कि I'm more important than others, and you feel, some of them feel that they have a lot of money, or they get annoying and irritable. They want to talk to people who are important. So all those things come, but most common being energy and sleep.
Okay, so how do you treat these patients? Because since you're telling that these patients are like they have a lot of energy and they're just those grandiose big feelings and think a lot. How it seems like it's
Right.
very hard to deal with them.
It is hard to
treat
deal with
them.
because they don't want to come to see the doctor.
Right.
Because they don't have any insight. Insight is awareness of illness. They don't know. So what happens is somebody else is going to take them or bring them to the hospital because they have done something which is really bad. So they
Right.
will come under maybe by force, by police or something like that. Mania का treatment CBT नहीं है.
Okay.
Mania का treatment purely medications है. You have to calm them down. But the good thing is it's a very, very treatable disease.
Okay.
और हफ्ते 10 दिन में usually they are better if they get medication, provided they take the medicine. The right
Provided, so you have to make sure that they are taking the
Absolutely.
medicines. So what do you
so
do?
warning symptoms again लोगों के लिए बताता चलूँ कि if somebody you feel they have mania, lack of sleep is one.
Okay.
Not sleeping for 2 or 3 days in a row, and having lots of energy and talking too much too fast.
Too fast, or maybe doing crazy things like maybe overspending or just.
Overspending is very common, but a lot of times people say they're overspending $200 because they don't have any money. But the definition of overspending is when you are overspending based on what you have. So if you are a millionaire and you're spending $10,000, maybe that's 200 for you.
For you,
So
right.
overspending is there, absolutely, but it's variable. Adventure seeking, drugs,
Right.
driving fast, reckless behavior, all those
Reckless,
things.
yeah, okay. That's so. One thing, you have to hospitalize them because they're just going to be out of control.
If you catch them in mild mania, which we call hypomania,
Yeah.
you can treat outpatient. If you're catching them in the severe stages, you do have to hospitalize them.
Okay, yeah, I was coming towards hypomania. I'm glad you. So, what is hypomania?
Hypomania की simple सी मिसाल ये है कि it's exactly same as mania, मगर अगर mania में your volume is at 10, hypomania में your volume is at 4 or 5. So
Okay.
same symptoms, you decrease the intensity, थोड़ा सा intensity कम कर दे. और mania का हम कहते हैं कि एक हफ्ते तक you need to have symptoms or you're hospitalized. और hypomania में 5 दिन तक, 4 दिन तक और you're hospitalized.
So, how long should the symptom duration be for hypomania and for
Hypomania
mania?
is 4 or 5 days, and mania is usually a week. But the caveat is that if you're hospitalized before, meaning the symptoms were so bad that you're hospitalized, then we're not going to wait for a week to say you're manic. Then you are declared manic because you're hospitalized. They were so bad that there was functional impairment. Psychiatry में functional impairment का बहुत बड़ा role है हर diagnosis.
Right, right. So, when you say functional impairment, can you say it in simple words for our viewers
जी,
to
functional
understand?
impairment से मुराद ये है कि अगर बच्चा है, स्कूल की परफॉर्मेंस खराब हुई है, अगर बड़ा है तो जॉब की परफॉर्मेंस खराब है, घर में खराब है, लड़ाई झगड़े हो रहे हैं, जॉब में आप झगड़ रहे हैं, बात नहीं कर पा रहे, काम नहीं कर पा रहे, दैट इज फंक्शनल इम्पेयरमेंट. जो भी आप काम कर रहे हैं, स्कूल में, घर में, दफ्तर में, वो सब मुतासिर है. That's functional impairment.
And the people around you are also affected.
They
Will be-
actually notice more than you.
Yeah, they're like, what is going on with him?
They
You know,
notice more
you
than
need
you.
to go to the hospital.
Exactly. They
So-
notice more than you.
Okay. Let's talk on a lighter note. We talked about so many things, and I know it's just, again, I think psychiatry is, there is so much to talk about. In this section, I want to talk about just, you know, a little minor stuff, a little more about you. You are always on the media. You're like a celebrity. You know, whenever there is something to talk about psychiatry, the first word is, let's call Dr. Asim Shah. You know, so you are here. You talk with the American media, and then you talk with the Desi media. You know, our Indo-Pak. So, what is the difference, and what do you like more?
First, thank you for calling me celebrity. That's not the case. But
you're
yeah,
so
I'm
humble.
on media a lot. I've given over 500-600 interviews in US media. The difference is there's subtle differences. So, for example, most of my US media talks are live. So they don't necessarily tell me what I'm going to talk. I go there and they will start discussion on something, and you just have
Awesome.
to talk. You don't have any time to
Yeah.
rethink or recapture anything or read anything. You just have to do it. So that's one difference. Second is they're short snippets, usually not long, but they are very powerful snippets. So they are played throughout the day, whether I'm on NBC or CBS or Fox or whichever. So that's another thing. And the third thing is that the awareness of those hosts is very different. They will openly say, oh, I suffer from depression also.
Right.
So it's a very
Yeah.
different. But you know, both medias are very good. And I think both can play a difference in reducing stigma. Absolutely.
Correct. That is absolutely correct. But no, I agree with you. Over here in the United States, people are more they are more
Open to talk
upfront.
about it, yes.
Yeah, they are more upfront. They will tell you, "Oh, I'm suffering from depression," or "I had a bad time." But the thing that you'll find out with the Desi people is that they will never say that I was suffering from depression and anxiety or anything. Although they are and they are seeing doctors, but they will never talk about it. So that's one thing. What about the professionalism?
Professionalism, they're very professional, but a lot of our Pakistani media people or Desi media people are very professional. You will have exceptions everywhere, certainly.
Right.
But, I've been on numerous channels. Right now we are on Geo, very professional people. My producer is very professional.
Yeah.
Cameraman is very professional. Our director is very
Right.
professional. Our sponsors are very professional. And we appreciate Geo for having this program. We appreciate our producer, Najam Saab, our director and cameraman, Dishan. So, I mean, very professional people everywhere.
Yeah.
Again, you can find exceptions in
Everywhere,
everything.
yeah.
But the resources and means are very different there. So they have a huge studio. The resources are great. The means are great, which is less in our media. So that's another difference here. I'm a Dow alumni. I love to give back to Dow or Jinnah or Arhan or other institutes. This time I'm going to Habib University also. So we do a lot of education. Why? Because education is something, it's like a darya. The more you
Right.
give, it's not going to stop. So you continue to do that. And I think that makes always a difference. और एक और चीज़ ये होती है कि when somebody meets you as a psychiatrist, the most important thing I would say is, so you go somewhere and you introduce, people say, what do you do? You say, you're a psychiatrist. I see a lot of people having a knee-jerk reaction. They
Really?
immediately, oh, you are a psychiatrist. That means you
Okay.
are judging us or you're analyzing us. So that's not true. That's not my job to judge you or analyze you. My job is to not judge anybody. We don't judge anybody, even after our patients. Why would I judge somebody outside? So it happens a lot.
Really? So when you're sitting with a bunch of other doctors and you tell them, do they? Wow.
It happens a lot. That's the most common reaction I see and most of us see. Yes.
Oh, okay. I am. Now you got me thinking.
आपका जो analysis है वो आपको उसके बाद मिल जाएगा.
Okay, all right. I am kind of nervous, viewers, right now. I don't know what kind of analysis I'm going to get. But yeah, well, that's great. So you're right, because मैं अभी पाकिस्तान से I've been कुछ अर्सा पहले ही आई हूँ, and you're right about that now people are taking it a little more seriously.
एक difference और है जो मैंने जिक्र नहीं किया. यहाँ पे we see maybe, I mean, private psychiatrists sometimes see a lot of patients, but on an average, अगर आप academics में जैसे मैं Baylor में, you see maybe 20 patients a day. Pakistan में, because there are very few psychiatrists, they see a lot of patients, like maybe 50, 100 a day. So थोड़ा सा फर्क है क्योंकि availability नहीं है, they have to do that.
Right, and in Pakistan, I think most of the psychiatrists वो इतना ज़्यादा उनके पास patients भी नहीं आते, because को मानने के लिए तैयार ही नहीं है.
अब आ रहे हैं, अब बहुत आ रहे हैं. There's a long line and there are few psychiatrists.
There is. Yeah, I think like you talked about defense and Clifton and all that. I am from Punjab, and so मैं लाहौर की बात करूँगी कि लाहौर में साइकाइट्रिस्ट के पास जो लोग आ रहे थे, जो एक तबका आ रहा था, वो वाला तबका था जो more into fashion and then ADHD and then I'm having panic attacks
मगर
and all that.
पाकिस्तान में स्टिमुलेंट नहीं मिलते.
पाकिस्तान में stimulants नहीं मिलते.
पाकिस्तान में.
Okay, all right, I didn't know that. But I am glad you talked about it and you mentioned that, because now there is an improvement in that part. And I think we should really, because, and you go to Pakistan a lot, we should talk about bringing awareness on a government level, like talk to the government and, talk to the Prime Minister. They have already done very good job. I was this morning, I was actually going through this media feed that the Punjab government has taken an initiative about child begging. So I was very happy to read that, because, we need to stop that. So I think this is something that we need to take on a government level, talk about importance of medical health.
Segue to that. कुछ अर्से पहले पाकिस्तान में there was a person who's schizophrenic who ended up killing somebody or so. They were hanging him. Psychiatrists in the community were able to stop them because he suffered from an illness and he did that based on his illness.
Right.
So वो awareness अब आहिस्ता-आहिस्ता आ रही है.
Thank you so much. We had a great time. I hope you enjoyed it as much as we did. Till next time, take care of yourselves and stay blessed.